This video will describe the third oral health core clinical competency domain, preventive interventions. According to HRSA's white paper on integration of oral health and primary care practice, Domain 3 recognizes options and strategies to address oral health needs identified by the first two domains, risk assessment and oral health evaluation. The competencies for primary care providers in this domain are to implement appropriate patient-centered preventive oral health interventions and strategies, and introduce strategies to mitigate risk factors when they are identified. For the purpose of this project, we will be focusing on fluoride varnish as the preventive intervention during the primary care prenatal visit. One critical piece for this domain is the documentation of the preventive intervention or fluoride varnish during the prenatal visit. Billing codes can be used to document and track fluoride varnish applications during the visit. Other options for documentation could also be structured fields and templates within the electronic medical record or EMR. The primary care team can also document the fluoride varnish within their clinical note. This image is a fluoride varnish card developed by one of the original pilot teams during HRSA and NOAA's 2015 pilot of the core clinical competency domains. This card was similar to an immunization card. The card helped the medical and dental department identify when the last fluoride varnish was given. This slide shows some examples of documentation for fluoride varnish within the EMR. In both of these examples, a template was built that included domain 1 and 2, risk assessment and oral evaluation, as well as a place to document and track fluoride varnish applications. Some things to consider. 1, does your prenatal team understand the current guidance for oral health care during pregnancy? The guidance can be found in the National Consensus Guide and is also reviewed in Smiles for Life. 2, at what prenatal visit would fluoride varnish be given? Note, your team should select one prenatal visit to start, then it can be scaled up. Selecting one visit will help with consistency across team members and ensure that the data can be collected more efficiently. 3, who will apply fluoride varnish? Teams should consider reviewing their state practice acts and Medicaid guidelines to determine who can administer and bill for fluoride varnish in their state. 4, how will you document and track fluoride varnish applications during the prenatal visits in the electronic medical record? Documenting in your EMR is ideal. It will make pulling records much easier. Some examples of this were shown earlier in this video. This final slide shows a project measure related to the third domain. The measure definition is the percentage of pregnant women who received fluoride varnish during pregnancy by a primary care team member. To break down this measure, the denominator is the total number of pregnant women seen for the specific visit your team selects during the reporting month. The numerator is the number of pregnant women with a documented fluoride varnish application during that specific month given by a primary care team member during the reporting month.